Hi, my name's Aaron Stigers. I'm a nurse practitioner. I teach at the College of Nursing, and I also provide care here at the Martin Luther King Health Center. And I'm here to answer a few questions that some of our patients have about men's care. Considering the top health concerns of men here in Louisiana, heart disease is a huge factor along with stroke risk. So you could kind of lump those into cardiovascular or atherosclerotic problems or problems with your veins and your arteries. Other big factors for men's health include mental health, evaluating patients for depression, suicide, as well as cancer risk with prostate and testicular cancer for younger men. Idealistically, it'd be perfect for everyone, men and women, but especially men, to go and see their primary care provider at least once a year. Going to your primary care provider once a year allows you and your healthcare provider to become in a better relationship to take care of your health needs. Going once a year allows you to have screening questions answered and to be able to provide some guidance on living a better, healthier life. Annual labs are kind of determined by the doctor and the patient that's coming in for service. When you're a client going to a healthcare provider, you might have a laundry list of issues and complaints, or you might be perfectly healthy and not have any kind of health problems that you know of. Going to the health provider's office, those screening recommendations that we talked about earlier, as far as being evaluated by your height, weight, and some basic physical exams by your provider, help to decide what kind of labs are necessary. Generally, patients will have a complete metabolic panel, or CMP, and a complete blood count, CBC. These kind of evaluations by lab work help to spot early signs or symptoms of problems such as diseases of cancer or kidney dysfunction or diabetes. Even if you're feeling fine, going to the doctor is a good exercise. It is a reminder for you to think about your health, whether that be your mental, your social, or your physical health. Generally, I think a lot of people go to a doctor or a nurse practitioner thinking that you only need to go if you're sick, but really a holistic approach to medicine is important for talking about preventive care services. A lot of patients and clients in the last 2 years have had obvious questions about vaccinations. So going to a doctor or a nurse practitioner or physician's assistant is helpful for improving your understanding on how to take care of yourself and to be the best version of yourself when it comes to preventive care. Daily steps that can be taken to improve your health are, of course, going to be eating a healthy diet. What you put into your body really matters. If you're putting trash into your body, it's not good for your body. Your body has to process it and to try to improve its health with suboptimal fuel. So diet is hugely important to your health. As far as other things that you can do, physical activity is very important. Physical activity has declined significantly in the last few decades, where people are not going out and walking and doing activities. Lack of exercise leads to poor health outcomes and can impact lots of different parts of your health, including your mental health. When considering the possibility of cancers, prostate and testicular cancer are both important things to screen for and to provide health guidance. And these are sometimes subjects that we talk about during different points of your life. With prostate health, this screening usually doesn't start until you are older, at least into your 40s. Patients with high risk of prostate cancer are sometimes screened at younger ages, but generally in 40s is when we'll start screening for prostate cancer or changes with the prostate. A lot of changes happen with hormones, which can regulate and change the size of a prostate. A prostate simplicity is kind of a donut-shaped anatomy that goes around the urethra or around where you pee out of. So as it enlarges, it starts to constrict and cause some problems with urine flow. But it can also be, cancer-related versus age-related changes. So getting a prostate exam is important, especially for the aging adult. Prostate cancer is a real risk factor for many men. Men, especially after the age of 50, are at higher risk for developing prostate cancer, and prostate enlargement is very common. Sometimes a prostate cancer can be deadly and can lead to other problems of metastasis. Early treatment and early diagnosis and screening are very essential in getting the right kind of treatment that is needed. Diagnosis and screening can be done through digital rectal exam as well as through laboratory testing, and is done on a basis based upon the comfort of the provider and the patient and how often that screening needs to be done. Generally, once prostate screening is initiated, usually this screening will be done annually, but it is up to the discretion of the patient and the provider. Prostate cancer is a risk definitely for an older male. However, for younger men, testicular cancer would be a higher risk factor. Most clients who develop testicular cancer do this in their more formative years of anywhere from 16 to their late 30s. That is usually when we start to see problems with testicular cancer. So I encourage all of my young male patients to at least be evaluated once and to be able to demonstrate how to do a testicular self-exam, being cognizant or aware of what your testicle feels like and how it's shaped is important to detect any kind of abnormalities and changes. So being self-aware is very important because you want to take care of yourself. If you find any kind of abnormalities, doing a testicular self-exam, it'd be important for you to go to your doctor for further evaluation and treatment. All of these recommendations are important, and I really encourage all men to see their doctor at least once a year.